Good morning and welcome back. It's been a while since we've been here to give you an update on Sage Point, but I'm here with Andrea Dwyer, our president and CEO, and we have some news to share with you, so we thought we'd fill you in. How is everything at Sage Point these days?
So Sage Point is doing very well. Obviously, we still continue to be very concerned about variants, even though we are fully vaccinated and our staff did a wonderful job of being vaccinated. But I think that this is right now just a hard period for us also. This is almost the anniversary of our outbreak. We were 25 days from start to finish of the outbreak, and it's a very special time.
It's a special time. It's a special time for the families, and we know that as they experience that 1 year, it's tough to have an anniversary of a death at any time. But to go through that and then to have the staff remember those people that were their family and loved them so much, and we remember them and honor them every day.
Yeah. I think again when you know how difficult it was for our staff, how difficult it was for everybody to come in, given this was a novel virus, but I couldn't be prouder of the staff and their consideration to still come to work, their compassion to come to work when all of that was unknown, and their compassion to continue to stay and provide care and services to the residents that remain with us and to consider those that were lost.
And it's not just, it is for us, most importantly, the residents of Sage Point, but it's residents in nursing homes across the board. It's been a year of really big effects to nursing homes across the country, across the world.
Yeah, it really has. And I think as the science unfolded, we learned so much more about COVID, this new virus, its transmissibility, its effect in tight spaces with stale air. And so, you know, I've always said, and I continue to say, as we've seen over time where households broke out, that is what we are. We are a big household.
Mm-hmm.
We are their home. And so it's still a difficult period, and we still fight every day to keep every resident safe.
Yes,
so
yes.
Every one of our patients really matters to us.
And we know so much more now than we did a year ago.
Yes. You know, there's so much more coming out about the science from that time, and more education, and we still track it ferociously. And again, you know, even with vaccines, we still are very concerned about variants, and even a vaccine that's 90% effective, when you're taking care of 300 different people between staff and residents and all of that, that is still a big number that 10% will have an ineffective response to a vaccine.
So while we know more and now we're able to have some visitation and the residents are able to come out of their rooms more, and all that is so positive, you know, it's still, we still need to be diligent on top of it.
Yeah, we are.
Yeah.
We are. And it has been a pure joy to be able to see residents really come out and play bingo. And even though we remain bubbled and get outside and get sunshine, it has been a really fun thing.
We've been very open and transparent with our community via these videos and via our communication about everything that's happened to us over the last year and about everything that we have been battling with the Office of Healthcare Quality. And we have some news to share about that. So would you like to tell our friends?
Yeah, so this was a difficult decision. So the decision to go to take Office of Healthcare Quality to court so that our story could be heard by an independent third party was a very easy decision for us. But it's been a bit difficult decision to figure out how to present that outcome. You know, we want to be respectful of all of the patients, of all of our staff, but we had so many supporters. We had so many people in this community that stood by us, that stood with us, and we really felt like we owed them this video. More than anything else, and we owed it to our staff as well. And so we did take the Office of Healthcare Quality to court in December. It has taken a long time to get the judge's ruling, some transcription challenges and things like that, but we did receive the judge's ruling, and the judge has determined that we will have no deficiencies that were cited. They are all to be taken away, and we will have no fines. And we think that that was the right ruling, obviously. And we were also very, very lucky. We had a judge who paid attention, who let everybody's story be told, including the Office of Healthcare Quality, ours as well. But she was very engaged, and we are very, very grateful for that.
And it was a 58-page, very thorough decision that she handed down and found, in a nutshell, we did everything we needed to do to fight for the residents, and we went, in fact, I think she says in her findings that we went above and beyond what we needed to do.
Yeah, I think she comments on the foresight and the steps we took well in advance of guidance and direction, and at times even, frankly, we test it when we were still being told don't test asymptomatics, and I think that really weighed with her. And hopefully, as this information becomes available, people will begin to understand that SagePoint did everything we could, and it was very early in the virus. And what we said is exactly what was the truth. What was going to be necessary for nursing homes to remain safe is routine testing and routine good product PPE. And it's those things that we have that we attribute to being able to stay COVID-free for any of our residents for almost a year now. We didn't have a spike in the second spike that came around in July. We didn't spike the third time. And as everybody now knows, there is significant concern about a fourth wave, and we keep our fingers crossed as well every day.
And it's a tribute, really, again, to the staff, again, who have been very diligent about being careful when they leave SagePoint after their shift is over, and not putting their residents at risk when they come back to work.
Yes.
But the fact that we now have testing available, our staff gets to be tested twice a week.
Yes.
And the vaccination rate, I think because of everything we went through, we were very fortunate to have so many staff opt in for being vaccinated, as well as the residents.
Yes.
It's made a huge difference. A lot different landscape than it looked like a year ago when we were sitting here talking. So
it is a very different landscape, and we are very, very grateful for the resources, for being able to get the resources that were needed, that were not available early on.
Yeah.
So we're very grateful. And again, I think for us it was very important to make sure that we made this statement in a way that was as respectful as we could be, but we owed it to our staff, and we owed it to everybody in this community who was so incredibly supportive of us.
And we want to really say thank you, because it was a lot of those supporters who wrote very nice letters to the staff and supported them, who had posters, who did parades outside of the building, and who sent people singing uplifting songs for the staff, who were standing there out the windows looking with tears streaming down their eyes, that they were grateful for that appreciation. So they really worked hard this year.
Yes. And let's not forget all the food. So,
oh my gosh, yes.
So staff love food.
Yeah.
So it was really nice. It was a very difficult time, and knowing that support was there meant everything to us.
Yes, very much. Well, I thank you. Do you have anything else to add?
No. We're very grateful.
Yeah.
And we will continue to go through this process. Unfortunately, we still have a federal process to go through, because you have to go through both the state and the federal process, and that'll be another 18 months. And we will continue to fight the virus every day.
Very good. Yes.
Thank you.
Thank you. Well, thank you very much for joining us today. We will be back soon with another update on SagePoint. Thank you.